Good day, everyone. Now we will start the webinar. Today's webinar is on advancing the integration of social assistance and labor market programs. Welcome everyone to the webinar from different parts of the world. Today's agenda, we have a quick introduction to DCI as well as to the speakers, followed by two country presentations. The first one will be by Türkiye and the second one by South Africa, a half hour each, followed by a panel discussion. And then we will have question and answers from the audience and closure of the webinar. A simple housekeeping rules. We request you to kindly post your questions in the Q&A box and not in the chat. That will help us to pick your questions from a single source, which is the Q&A box. If you have any comments or resources to share relevant to the webinar or otherwise, you can share those in the chat. Simultaneous interpretation is available. You can select the language in the interpretation icon on control bar. We have interpretations in French, Spanish, Portuguese, and English available. And this session will be recorded. So we deem your consent to be recorded when you switch on your camera and speak during the webinar. So now a very quick 2-3 minute intro to what is this Digital Convergence Initiative, which is organizing this webinar. So the Digital Convergence Initiative is a working group under Universal Social Protection 2030, which was launched in 2021. And its objective is to support digital transformation of social protection systems globally. So this initiative is funded by European Union as well as the German government. And this is implemented by 5 implementing partners: GIZ, ILO, World Bank, Expertise France, and FIA. So what does DCI do? So DCI has got essentially 4 pillars of work. The first one is knowledge sharing, where we conduct events like this, talking interoperability and other workshops, and also develop written knowledge products in terms of guidelines, case studies, and learning briefs on each of these webinars, which you can find on our website. All these events which are recorded are also available if you are interested. The second pillar of our work is development of global consensus-based interoperability standards for social protection delivery chain. So we have standards for different interfaces to promote interoperability in delivery of social protection programs. And these standards are open standards available on GitHub to anybody for adoption. And we also welcome anyone interested in contributing to the drafting, development, or reviewing the standards to join. This is an open community. The third pillar is, once we have these knowledge products as well as the standards, we need them to be utilized by the countries to achieve real digital transformation, which is the objective of this initiative. And towards that goal, we also support countries financially as well as with technical advisory on implementation of digital transformation projects through these 5 implementing partners. We are targeting about 18 countries to be supported with financial support, as well as we are going to launch a help desk for digital transformation for expanded outreach to many more countries. And the fourth pillar, which is listed as a bullet here, is providing capacity building trainings to countries and practitioners to implement digital transformation in their respective sectors. So some of the standards which we have already developed for interoperability, you can see on this visual where we are saying, how does the social protection management system interact with civil registration to deliver social protection programs? Similarly, how does a social protection beneficiary management system interact with integrated beneficiary registry, social registry, ID systems, payment systems, farmer registry, and disability registry. So we have 5 interfaces already published, including farmer registry recently, and ID systems and payment systems we will be picking up next. So if anybody is interested in joining these standards committees, you are welcome to reach out to the SPDCI contact email we'll be sharing during the workshop or via LinkedIn. So what is this Talking Interoperability webinar as such? So the Talking Interoperability series was launched by DCI to have in-depth technical conversations around integrated and interoperable social protection information systems across countries to understand what does it take for systems to become interoperable, how agencies have tackled the challenges they have come across in this journey of interoperability, and to brainstorm potential solutions to overcome these challenges. And this one is a little bit different in the sense that we are looking at how does social protection system interact with employment systems. And this is going to be a new stream of work for us in developing interoperability standards. So the recordings of these past sessions are available. You can go to the website and access both the presentation as well as the webinar recording for whichever country is of interest to you. Now I get into the introduction of our speakers. So today we have four speakers, including me as the moderator. So let me introduce myself first before I introduce the others. So this is me, Anita Mittal. I'm leading the Digital Convergence Initiative at GIZ, and I've been there since the start of the project and have a technical background. So with a computer science degree, I look after most of the technical aspects of this project. And joining us today is Ercan Dansuk, who is not new to DCI. He has already joined a few other sessions of DCI. So today he will be presenting on the interoperability of SP systems with employment from Turkey. So Ercan Dansuk has graduated from Department of Sociology, Middle East Technical University in 1989. He has worked on the policies on alleviation of poverty in the State Planning Organization of Turkish Prime Ministry for over 25 years. He brings us a lot of experience. He has joined the Ministry of Family and Social Services in 2018, and so far he has worked as social protection specialist at FAO between 2019 to 2021. His specialized career areas are income distribution, poverty, policies on combating poverty, implementation of SDGs target for Turkey. Welcome to the webinar, Ercan. The second speaker who will be presenting from South Africa, the same interoperability, is Mayopone Shabalala. She's a senior manager, business solutions with over 10 years of experience in both private and public sectors. She specializes in software innovation and leading system development teams. Her role includes collaborating with stakeholders, securing funding, and ensuring cost-effective, scalable solutions. She contributes to the digitization program of SASA. She will explain what that acronym means later in the presentation. Improving service delivery and efficiency. Joining these two speakers from country presentations, we have Josefina Posadas, who is a lead economist in the Social Protection and Jobs Global Practice of the World Bank Group. In this role, Josefina is responsible for working with client countries to develop and implement policies and programs to improve labor market access and success, particularly for more vulnerable populations. Her most recent World Bank publication focuses on developing advanced labor market information systems. And The second discussant on the panel, we have Louisa, who has 20 years of experience in public sector, currently working as a counselor at the Ministry of Labor in Romania. She has contributed in major reforms in education, social services, and digitalization. She monitors and reports the implementation of the NRRP, focusing on key milestones in digital, social, and pension reforms. She has contributed to the development and implementation of over 20 projects throughout her career. So we have a very experienced panel of speakers, and without further ado, I would invite our speaker from Turkey to take over the presentation and the mic.
Okay, thank you, Anita. Thank you for your kind and open words, and you have made a very strong opening speech, and you have summarized all the details about this event. And I would like to thank to the Digital Convergence Initiative platform for inviting Turkey and the Ministry of Family to do such events. I think it's very good and better for all of us to share our knowledge, our problems, and our solutions in such platform. And let's go to the slides. Yeah, Turkey is as you know, is a upper middle income country. As you see, is a its population is about moderate population is about 85 million. It's the 19th big populated country in the world. GDP is about 1 trillion. GDP per capita is about 11,000 dollar, and GDP growth rate is about 5%. But the employment rate is a little bit problem when you compare with the developed employment rate about 49%. Especially the problem in the employment market is the female participation rate. It's about just 32%. And number of people in the labor market is about 35 million. And another big problem in our employment market is the net rate is growing over the years. Now it's about 23%. And population over the 15 years old is about 60 million, and unemployment rate is about 8%, and number of unemployment in Turkey is about 3 million. And another important issue for the labor market in Turkey is the youth employment is about 15%. Let's go to the other slide. And but in the last 2 or 3 decades, Turkey has developed their social protection system. That's why the poverty rate decreased in a very important rates. As you see, at the beginning of the 2000, it's about the poverty rates about the 40s, and now it's about it decreased to the 7%. For it is the same for the relative poverty rate. In the last two decades, as you see, all the poverty rates are decreasing. And how we did it in the last 2 decades, we have developed our social protection system. I will talk about in the next other slides. Let's go to the next. And when you look at the Turkish social protection system, we have a dual system. In the one side, there is a social insurance system governed by the Ministry of Labor and Social Security. This ministry runs the social insurance program, employment programs, uh, especially, and it covers these two programs covers the 89% of the population. And the other side is the social assistance and social service side, covers the 11% of the population. And these population are generally out of the social insurance program. That's why I said it's a dual. Our social protection system has a dual character. On the one side, there is a registered population in the social insurance programs, and on the other side, the social assistance programs, people who do not have any protection mechanism like health insurance or the other insurance program. That's why we have created such a program to protect the people. Let's go to the other slide. As a Ministry of Family and Social Services, we run the social assistance system. As you see the organizational structure of the our social assistance system. At the top, there is a fund board, social assistance fund board, and as a implementer, as a responsible body, the Ministry of Family and Social Services, and the General Directorate of Social Assistance are the main responsible body at the central level. And also, Turkey has established more than 1,000 local offices for social assistance programs at every district of the Turkey. That's why we can regionally, our programs regionally cover all the parts of the Turkey. And in this program, we have registered 21 million households of the Turkey. It's about 72 million of the population. Let's go to the other slide. Yeah, what we have established at the beginning of the 2000, it's called the Integrated Social Assistance Information System. After we established this system, we could reach the people, we could reach the vulnerable people in all over of the region in Turkey. That's why this system is very important, because you can create the civil registry and the both social registry of the vulnerable people, vulnerable population. Let's go to the other slide. What we have done in this system, we at the beginning of the creation of this system, we integrated different institutions and their databases on ISAS. In that, now we get the data from the 29 different public institutions, and we use the 120 web-based services. What we have done in this system, we have standardized, integrated data system, and we have converted our database from the paper-based procedures to the electronic electronic system. Now, as I said in the previous slide, and our social assistance system covers the 25% of the population. The 11% of the population are the poor, economically poor people, but 10% also 10% are the vulnerable people. Our system allow us to see to catch the not just the poor people, also we can catch the vulnerable people by using the ESAS system. Let's go to the next slide. And yeah, this is how we operate this system. Mainly, there are three processes in our system: assessment, enrollment, and the monitoring system. As I said, as you see in the administrative data, when an applicants come to our offices or apply, make an application by using the online system. The applicants, when they give their national identity number, our system ISAS automatically get the data from all the public institutions, by using the administrative data. We create the social registry of these applicants. And after the administrative data that we get for the applicants, we also go to we also visit the house of the applicants. Why we visit them? First, we need to check what they said when they apply to our system. They filled an application form and social inquiry form, and they declared their socio-economic condition. Our social workers, when they go to their home, they check all the details about this household, and also our social workers observe all the socio-economic conditions of the household. For example, they may not say anything about they have elderly people or children without school. Maybe they do not say anything about that. And our social worker can see such kind of vulnerabilities in the household. After that visit, social workers create a file for that household by using the administrative data and the household visit data. There is as you see in the enrollment process, we use both proxy means testing and the hybrid means testing, especially hybrid means testing we use for the universal health insurance. And then after preparing the report, they sent this report to the Board of Trustees. Board of Trustees is a board covering all the public officials and the local leaders. They can decide that household are eligible or not. After they decide they are eligible, at the center we list all the eligible households, and then we create a list for them, and then also we allocate the money, the budget to our payment office, the post office, and we send to this money to the PTT post bank or post office, and PTT allocate all the social assistance to the households account. And also, post office can monitor all the payment process, and after the payment, process, they report to us what's going on. Is there any problem to payment process? And we can check we can monitor all the payment process and also grievance process at this third level. Let's go to the other slide. Yes, when we as of today, we talk about the social link between the social assistance and the employment. Uh, in our social assistance system, we have two main parts. What we aim is to increase the resilience of the our beneficiaries, and also we need to create some exit strategy, because it is not feasible to fix the people in the same program. We need to force them, or we need to support them to exit the or to exit the poverty level. For the increasing resilience program, the cash transfer and the referral services, we use these main two programs. For creating exit strategy programs, we have job replacement and skills improvements. Let's go to the other slide. For the increasing resilience program, you see the many programs. It's about the more than 50 programs. We have the social assistance program in the system. We can say that in the there are five main issue in the system: family assistance, educational assistance, health assistance, sheltering and food assistance, and disability and all assistance. And also there is another program, the project support, especially this is for the exit strategy. We use these programs uh, to to support the people. Let's go to the other slide. Yeah, let's see the job replacement and skills improvement program. Uh, when we look at the whole population in our system, we can see that approximately 18% of social assistance beneficiaries are able to work. That 18% are the target population for job replacement and skill improvement programs. What we provide them, first one is the employment referral programs, and the other is the skill development program. And for the referral programs, we work with the İşkur, is a Turkish employment uh, agency. We work with them. And skills improvement program in the under the Ministry of Family, at the local level, there are many family support centers and social solidarity center. Especially our main group are the women in the system. So far, we have reached 11% of our potential beneficiaries, and 11% of our beneficiaries are registered in our employment market, and 14% of the 11% recruited and employed in the labor market. Let's go to the other slide. Yeah, especially 2016 is very important. Is very important for to create to strengthen the link between the social assistance and employment programs. There were some programs before the 16, but especially government create new regulation and the circular to support these links. We increase the collaboration as a ministry. We increase the collaboration with the Turkish Employment Agency in that time. Let's go to the other slide. Maybe I need to summarize what the İşkur, the employment agency, does in Turkey. They have 6 main responsibilities: to make a labor market research, to develop the job and vocational counseling, and to provide the employment services, to create the employment active labor market policies, and also passive labor market policies. And the sixth one are the related with the international project, especially after the Syrian crisis. The İşkur, the employment agency, collaborate and work with the many international organizations to support the refugees labor market problem. Especially number 2 is related with our social assistance program. Let's go to the other slide. Yeah, what the İşkur, the employment agency, provide to our social assistance system. When we define any beneficiaries wants to get a job, we have some referral services, and what the İşkur does, there are some training programs, training services, and employment services at the first site before the employment, and also after the employment. İşkur supports these beneficiaries and also monitor their status at least six months. There are many. I don't want to give the details. You can follow the details in the presentation. As you see, there are job and profession. You see that there are job and professional counseling, job placement and cash assistance, multiple application assistance, and there are many details about these programs. Let's go to the other slide. Yeah. Why 2016 is important? Before the 2016, if a beneficiary get a job, get an income, their social assistance will be cut before the 2016. But government changed this rule. Even if a beneficiary get a job and get an income, their social assistance will continue at least 1 year. 1 year. This is very important issue for our social assistance system, because when we offer our beneficiaries a job, they know if they get this job, they will their social assistance will stop. That's why they used to refuse all the such offers, job offers before. But after we changed this process, our number of the beneficiaries for employment was increased, and and also we had we created some rules for some sections for the programs. For example, non-attendance at course or work-related activities disqualifies the individuals from receiving these assistance, which is used for monitoring. So this is another important issue. And also, government supports the employed people for at least 6 months. Uh, when they get a job, the government pay their social insurance premium for 6 months. It's another important issue. And on the operational side, the local foundation, our local offices are very important to monitor all the process before the employment and after the employment process. And also local offices of the İşkur employment agencies are important to follow all the process. We have strengthened this operational process at local level as well. Let's go to the other slide. These are the diagram of the what I have said about the mechanism. You can see these chart as a chart what I have said before. Okay, let's go to the other slide. Yeah, these are the some incentive in details, requirements to be met for benefit intensive. As you see, there should be all the beneficiaries should be in our social assistance system, and also they have to be registered in the İşkur system. In the system, and also there should be all the beneficiaries needs to have some eligible criteria for İşkur. İşkur, as you see. Let's go to the other slide. Yeah, as I said, the İşkur provides the many facilities to the beneficiaries. Vacancies suitable for their situation, vocational training, and vocational consular assessment, and especially at the İşkur at local level follow all the beneficiaries registered in their system at least 1 year, and also in this process there are some costs for the beneficiaries. The İşkur pay all the costs of the all process for the beneficiaries in that year. Let's go to the other slide. Yeah, when we provide some facilities, some support to the beneficiaries, we see that some beneficiaries didn't meet our requirements. For example, they don't accept the job referral, or we offer, they accept, but they don't attend the job. They don't continue the job. That's why we need to create some section for that beneficiaries, because it's very important for them because it provides it generates income for them. That's why we need to push them to get that job and the income. If they don't accept, they lose the many facilities and assistance in our system. We can check and we can control these link between the social assistance and the employment market by using these sections. Let's go to the other slide. And these are the first part is run with the Turkish employment agencies. And it's another program for to strengthen the link between the social assistance and the employment market, the skills improvement programs. In our ministry, in the Ministry of Family, we run the two main programs, the ADEM and the SODA, Family Support Center and Social Solidarity Center. We know that in the first part, there are some vulnerable people, but they can work, and we offer the jobs to them. But in that program, generally, these women are the most vulnerable people in social assistance program. They don't looking for job. They are totally out of the labor force. No or very low qualification or skills. They don't have any income. They are not able to afford the basic needs. As you see, generally, the housewives or young housewives and middle-aged housewives were out of the labor force system, and the Turkish Employment Agency, even the Turkish Employment Agency, for them it is difficult to reach these people for the Turkish Employment Agency. That's why we have created different programs, skill improvement program for that woman. Let's go to the other slide. Sorry, for SODAM, ADEM, the family support center for the women, SODAM for the Roma citizen. I will talk in the next slide. Yeah, in the family support center from 2011, we have 550 centers in all over the Turkey. We have reached 2.7 million women in that centers. Let's go to the other slide. For the SODAM, we have 90 SODAM, Social Solidarity Center. In that SODAM, we have reached about 300,000 women in that SODAM. Let's go to the other slide. Yeah, these are the main activities in the ADEM and SODAM. We provide some basic facilities, vocational trainings, courses, training, seminars, meetings, cultural activities, and at least we give at least 3 months trainings to the women. And also we try to create a link between the ADEM SODAM and the labor market as well. After this training, some of centers established the women cooperatives. So there are such examples in the ADEMS in these centers as well. So this is not too many. But we try to increase such kind of activities, such kind of cooperatives for women in ADEM and SODAM center. Let's go to the other slide. Yeah, yes, as I said in the previous slides, there need to be developed these centers, especially to strengthen the link between the social assistance and the employment system. especially there is a lack of employment referral mechanism in the centers and low job placement rates and un, untapped entrepreneurial potential and very low level or no link with the ISHKU programs. Financial sustainability is not good in these centers. So that's why we need to improve these centers at institutional level and at a financial level. And also, there is no standardized physical condition. Let's go to the other slide. Anita, I show you. This is the last one. Yes, this is the new program created by the ISHKU, especially when we developed our social assistance system, we can create the different kinds of vulnerable population. We can see the different kinds of vulnerable population, especially this is the third group in our system, especially the ISHKUR created such a program. As you see, there are some eligible criteria to benefit from that program. Let's go to the other slide. Yeah. They have identified the ISHKUR identified about 500,000 households in our system, in our social assistance system. In 5 years, they targeted to reach these households. In the last 6 months, they have reached 30% of these targeted population in the system. And what they have done, what they are doing for that targeted group, as you see, they give some individual counseling, job placement, vocational training programs, and other programs. And as you say, we have 3 big programs: household support system, skill improvement system, and the job replacement system in our social assistance. Let's go to the other slide. Yes, thank you, Anita. I hope.
Thank you, Ercan. Thank you so much for this very rich presentation, and very impressed with the success that has been demonstrated in Turkey. We have a saying where they say, give a man a fish and you feed him for a day. Teach him how to fish and you feed him for life. So I think what Turkey is doing is, is providing jobs as well as skills which can help them to take care of themselves, and with a lot of respect. So this is impressive. We will continue reaching out to you for sharing more details on these interactions subsequent to the webinar also. And we will have some questions from the panelists and the audience after the presentation from South Africa. So now I invite my opponent to present the systems of South Africa with regard to this employment and social assistance interaction. Over to you.
Thank you.
You're still muted, my opponent. Can you unmute?
Can you hear me now?
Yes.
Thank you very much. Good afternoon to everybody in the forum. Thank you for this opportunity to be able to share the experiences from South Africa with yourselves. I will be presenting on designing for interoperability, which is in the social protection sector. I just want to establish, Anita, is the presentation in presentation mode on your side?
No, it is not in presentation mode. It is still in the slides mode.
Right.
Now it's good.
All right. Thank you very much. Okay. Now I can see on my side. So from the presentation, as I've indicated, I'm representing South Africa, whereby I will be talking about designing for interoperability in the social protection sector. And this is in reference to the COVID-19 SRD system of South Africa under the Minister of Department of Social Development, Member of Parliament, Ms. Nokuzola Tolashe, as well as the acting CEO then of SASSA, Mr. Themba Matlow. SASSA, which is then the South African Social Security Agency, is an entity of the Department of Social Development, which is established with the mandate to administer social assistance to eligible South Africans. Looking at the landscape of South Africa in context, within the country, we are made up of 9 provinces and 257 municipalities, with a population of just over 62 million and 19,000 households, of which 50% of households receive at least 1 grant. Regarding the poverty index, we are standing at 41.8 million people who are living in poverty, which is then supported by the unemployment rate of just over 32%. If you look at the social assistance, more than 26 million South Africans receive social assistance every month, with 9 million of them receiving the COVID-19 social grant. With focus on the social grants landscape in a nutshell, we provide from SASSA normal social grants, which is the biggest cohort of who we administer to. And this is made up of older persons, the disabled, as well as the children grant. Then we've got a smaller portion or a smaller cohort that we administer to, which is the normal social relief of distress, which is issued then in case there is a community or a disaster in the family, as then guided by the regulations. Then our secondary biggest cohort is the COVID-19 SRD, which was introduced then in 2020 as a result of the COVID-19 pandemic and the linked lockdown restrictions. If you look at the numbers that are attached to the landscape of the social assistance, our normal social grants makes the biggest number, which is standing at about just over 12 million of the social grants that we administer to, with the COVID-19 SRD grant averaging between 8 to 9 million every month, because this is a monthly relief then to the clients. Looking at the South African information systems landscape, the main one that drives the identity number is that one for the Department of Home Affairs, which then issues the identity for all South Africans. And within it, there is about 94.2% of the population that has been registered then in the database. If you look at the social registry, this is a database that is still under development under the Ministry of the Department of Social Development at SASSA, with the aim then of collaborating all of these services within the social registry, which then include those services that are issued both by SASSA and the Department of Social Development. From a payments platform, we still have a diverse ecosystem of payment methods and infrastructure, which is under the Payment Association of South Africa. And within this landscape, we've got 82% who are within the payment ecosystem. From a grievance and redressal platform, it is available for social grants of those that are aggrieved with the outcome that have been issued by SASSA under the Ministry of the Department of Social Development, which is done then by the appeals board within the Department of Social Development to reconsider then the outcome that was issued by SASSA and be able to respond accordingly. If you look at our tax information system, this is quite a robust and progressive system within South Africa, which then collects the information about the revenue people who correcting to tax and be able to then claim. So within this, we've got 41% of our population that is contributing to the tax system, and therefore their information is within the tax database. From a social insurance management information within the formal sector, we still have individual insurance institutions managing their own databases. From a disability registry, also we have that instance of multiple institutions who have then this particular information. From a land and property registry, it is a consolidated database which is under the deeds office. From employment registry, from a formal sector point, we've got the Department of Labor. Then from a government point of view, we've got the PERSAL database, as well as the one for the government officials database. From the business ownership, we've got the company's intellectual property commission, which then all the businesses are then registered. From your inmates point of view, it's still a database that is very decentralized at regional level, where each and every province will have a smaller cohort of the inmates that are maintained, and is still not a comprehensive system that can be then used as a central database. Now, zooming into the COVID-19 system, what were we solving for with the COVID-19 system? At the point of introduction of the grant in 2020, 45% of the population was living under the poverty line, and that poverty line, which is 352 rand per month. So the COVID-19 was expected to impact unemployment and underemployment for informal workers. The biggest cohort of people that were affected then with COVID-19 and lockdown restrictions was the informal employment, which constituted 30% of total employment in the country. So the focus then was to assist with this, and the COVID-19 SRD grant was part of the relief of this. There were other programs that were focusing on this one, such as the one for UIF, that was the Employer and Employee Relief Grant. There was one also that was issued by the sport industry or entertainment industry, which was called the Sportsman Relief Grant. We also have the one that was done, which was concentrating on the farmers, which was also the Farmers Relief Grant. So there were a couple of those initiatives that was aiming to relieve then these sector that was majorly impacted by the lockdown. And in the lockdown period at that point in time, obviously then the hunger increased from 4.3% to 7.0% in that time. And I think what assisted us from a South African point of view to resolve for this problem was the ability then for the South African government to be able to pre-identify everyone that was affected and be able then to make that determination of the possible number of people that we can expect then to apply for the grant. Looking at the journey in terms of the development of this grant, for its administration, from the time that the president announced the lockdown in March to the time when in April, when he then announced the social relief of distress grant, SASSA then had just about less than 6 weeks to be able to develop the solution and be able to implement then the grant and be able to start paying those that were affected. If you look at the administration of the grant, it was important to look at these 4 elements, which was access channels. Because of the lockdown restrictions, this meant that our current landscape of the service office that are then distributed nationally in the 9 provinces and the 257 municipalities could not be used as they were closed due to lockdown restrictions. So it says SASSA then had to establish digital access channels for clients to be able to access the service. And the digital channels mainly consisted then of the website, the WhatsApp interactive channel, and the unstructured SMS channel, which is the USSD. From identification point of view, from South Africa, the main identifier across organizations is the identity number. Other organizations has secondary identifier, but within South Africa, the main identifier within institutions is the identity number that was then used to correctly identify the applicants applying for the service. Important for the service was the means testing, and within means testing, we are testing then for employment as well as proxy means testing then, because this is a monthly relief of the grant, so we need to test each and every month whether a particular applicant qualifies. So this was an important driver then for this administration, which then triggered and established the foundation for interoperability within government and private institutions. Then lastly, the benefit transfers, which was enabling the payment for this cohort of people that would apply, which at the point in time, the main benefit transfer channel was the electronic funds transfer into the applicant's bank account. We also then, through this initiative or this program, introduced the mobile funds transfer, and we also introduced the electronic vouchers with collection then at our selected retailers through our service provider, which was the Post Bank. And it was important to establish those non-physical means of benefit transfer so that we are able then to comply to the lockdown restrictions. If you look at the overview of the system, from an outreach point of view, our main channel is the website. At intake and registration, the most important information that we then collect as client then reach out to us, because this service is then driven from applicant voluntarily registration, not a referral system. So the client then, or the applicants, will provide basic information that then relates to their identity number, their personal details, as well as then their mobile cell phone number, inclusive of their bank accounts, as well as their address as basic information. As part of this intake and registration, there are the screening questions that we introduced. The screening questions purpose is to enable then the government to assess the circumstance of the individual. So the grant is individual based, not household based. However, the screening questions, even though provided and requested from the client, at the time of assessment and eligibility, the information that is used is then the data that we then receive through our data sharing mechanism. So regardless of what the client would have indicated as part of their registration, the main driver then is the information that we receive from other departments through our data sharing capabilities, as well as the proxy means testing then with the banks through that channel and capability that we have developed. From benefits and onboarding, once the client has been assessed and the outcome has been provided, the client or the applicant will then be contacted through SMS, or their outcome would then be updated on their application record on the website. This SMS would also indicate the outcome of the client and also indicate then the date on which they will receive the payments. What is important in the payment sector or payment space is that for the payments to be able to be successful, we are required from a PFMA point of view to be able to qualify or to verify that the bank account that the client has provided us with belongs to the particular client. So we cannot pay the funds to somebody's account. And that applies as well to our mobile payments, where it means that for that payment channel, we also need to be able to link that the cell phone number is linked to this particular client. From a grievance and mechanism and monitoring, we have then that leg of the Department of Social Development Appeals Board, whereby the client, through the same web channel, are able to apply then for an appeal to reconsider their outcome for a particular month, because this is a month-to-month grant, to be able to indicate why they are aggrieved by the decision that was made by SASSA. From an exit point of view, it is either the client voluntarily exit themselves by indicating that they are self-sustainable, or that they do no longer require the grant, or through the data that we then receive with our data sharing partners, we are able to make that assessment and be able to then exit the client. Now, this is the assessment that we have done with, in collaboration with World Bank. What this exercise was aiming to do was trying to map to say, if the COVID-19 SRD grant should be repurposed to be able to administer the social pension information system comprehensively, what would be the elements that SASSA and the Department of Social Development need to look at? So if you look at the assessment there in terms of what is currently available within the administration program and the system compared to the enhancements and the capabilities that are not yet there, there is work that needs to be done should then there be a decision to move from a comprehensive social registry point of administration. And I think what is important with the migration is, from a policy perspective, there still needs to be a policy decision to move away social assistance from purely an individual based to incorporating a household administration and social assistant model. It is important to drive then the system support for that particular administration principle. And that is also important, as you would see highlighted in red, the case management module, because that will enable us then as the government to be able to track the life cycle of an applicant before even getting into the system, and post that to have a comprehensive end-to-end cycle and view of the particular applicant. So this is just the framework and the assessment that we had done to prepare ourselves in terms of migrating from the social assistant view-based administration to a social services module then within the government. If you look at our technology stack, looking at our application point of view, the system was then developed from a technology stack using the open source development design principle, So I will not talk individually to the technology stack, but just to show that it has adopted some form of open source design principle. If you look at our integration point of view, we've got a service as well as a file-based integration embedded in the system. And from file-based, the main there being the secure file transfer protocol. And from a service-based, we use then the REST APIs, SOAP web services, messaging queues, as well as the Fiber Cloud messaging and tracking them. This is also then a depict of our infrastructure. And I think what is important about this picture is to indicate that our system is then hosted from a open Oracle private cloud. So it enables us then to seamlessly upscale our services as then we increase our capabilities within the system. And also it is important that from a security point of view, our infrastructure enables us then to be able to have a secure platform and infrastructure that supports the application. If you look at the evolvement of the system from the time of initial implementation, at the time of implementation, there was minimum capabilities that the system had, which then included onboarding and enrollment. And for the files that we were sharing, we only had 4 institutions that we were sharing the files with to be able to do eligibility and outcome. And from a payment point of view, the only payment channel in 2020 was then the electronic file transfer. From 2021, we introduced more capabilities. We introduced then the API gateway. We expanded then our payment module and channels to include mobile money. We included then other functionalities within the system, inclusive of cancellation, reinstatement, grievances, and we also introduced the internal staff module that enables then our customer care to be able to assist the clients then who call in and who cannot be able to do the self-service from the website. And more importantly, we included more databases from 2021, which then at the point in time, we had up to 9 databases, including that with the banks, that we're able then to assess legibility of the applications that we received. Between 2022 and 2025, we then introduced eKYC, and we introduced eKYC for high-risk transactions within the system. We are actually migrating, as in this Friday, we are introducing high-risk eKYC for all of the transactions in the system. We are moving away just from high-risk transactions. We also introduce risk mitigation services to be able to identify those identities that have either been victims of fraud or perpetrators of fraud. Through these risk mitigation services, we are also able to identify devices or cell phone numbers that have been used for fraudulent purposes, that have been blocked or deleted because of such activities, so that we're able to flag those records that are linked to such devices and mobile cell phone numbers from our side for extra controls and verification. We have accelerated our means testing with the banks, and we have included more banks in this particular space that we're able to test with. And from a processing and application point of view, we have grown then from 13 million applications to 17 million applications that we are assessing from month to month within the database. In terms of interoperability capabilities, why interoperability then was necessary at this point in time? As I've discussed earlier, with the SRD 350 COVID-19 grant, there was no any other way to administer the grant except to introduce data sharing and interoperability capabilities in the environment. to be able to administer the grant and comply to the regulations and the legislation requirement that required the month-to-month assessment using those particular databases to assess and be able to determine income, employment, and proxy means testing them. What is important is that we have extended from using the capability just from the SRD 350 grant system. We have now extended this capability to be able to improve efficiencies as well in our general administration for the normal social grant. And what have we realized through this process when we introduced the COVID-19 grant? It eliminated the need for documentation and submission. It eliminated the dependency on information from client, which is then prone to inclusion and exclusion errors. It eliminated the need for service office assistance and footprint. If it meant that we had to introduce this particular grant and incorporated it to the normal service office footprint, we had to increase then the number of offices as well as the resources that would be able to assist with this grant. So the interoperability and the digital principal administration of this grant assists us in that particular instance. And just to highlight some of the milestones that we've achieved in this interoperability, I will highlight two in the screen, whereby when we had limited databases, we had a lot of inclusion errors where we are approving close to about 11 million applications. But when we introduced more databases in the framework, we then moved to about 8 to 9 million. Also important is within the first 6 months of implementing this capability within the normal social grants, we're able to realize a reduction from the child support grant from 13.4 million to 13.1 million grants. This is just an overview of our strategic partners and data sharing agencies, as I've already highlighted in the previous slides. If you look at the mapping to the data sharing across systems, I'm not going to focus individually on this, but what is important about this picture is our main variable for data exchanging within these data sharing organizations is an ID number. At this point in time, the most common type of data sharing channel is still the batch SFTP. So we need then to migrate to API, and you will see the gaps then that was identified with a collaboration with World Bank to be able to migrate us with our data sharing partners from the batch SFTP based channel to a more real-time API channels. And I think what is also important about this picture is that with the type of data sharing mechanism, it then introduces challenges like incomplete data, out of date data, and data that is not fit for purpose because there's no governance and facilitation of data within these arrangements that we have, where individual organizations make arrangements then for their data sharing. It is not centralized. If you look at the linking to employment and skills within the environment, if you look at the picture on your right, the green bubbles indicate that this is the employment and skills opportunities that we've already established through the data sharing. If you look at the first one, which is the sharing of data with the Department of Basic Education, which is the government bursary, we are able then to provide data for our child support grant children who have turned 18 so that they could target these children to be able to migrate them then for higher education and learning through the data sharing. We also have an initiative that we run with Finmark Trust, where we are able then to also target the youth and be able to use them with this initiative and program with Finmark Trust to link these youth then to employment, and most importantly, to entrepreneurship skills and opportunities. Also, then our community work program, we also provide the data to them so that they can be able to identify the delegates who can then be referred for this work program and vice versa. And maybe just to mention within this picture that our aim to move then to be able to integrate with the red bubbles, just to mention the SA Youth Program, which is a very progressive program within South Africa, whereby currently it is still a individual registration by the youth to this database, and the youth are then be able to be referred through to the employment databases and skills databases. So although it's not linked to the social assistant data yet, but it is one of the programs within South Africa that is very progressive. If you look at the challenges that we are facing as it relates to general administration and interoperability, I think number 1 and number 3 talks to digital inclusion and exclusion, whereby in our most rural countries, there is regions, there is still those elements of people who do not have then the tools of trade or the digital tools to be able to communicate with our digital channels. So which then makes us to say, if we implement solutions, we must also be able to solution for this group of our clients. And I think what is important then to this is the need for a centralized database and digital identity within the South Africa. And that one will then assist us, and I will talk to it in the next page. I will not go through this one, I've touched on it. If you look at the next steps then to move us into full interoperability within SASSA itself and within South Africa as a whole, within SASSA to prepare ourselves for the expanded interoperability journey, we have worked with World Bank then to make those recommendations, what we should look at to be able to move towards a comprehensive strategy that extends beyond API, and also implementing data dictionary and adopting a robust data governance mechanism. From a South African-based perspective, then, there is a program within the presidency that has been started, and it comprises of the multiple government departments, both from government and private sector, which is to then build an inclusive and secure people-centered digital government, the objectives of which is then human-centered government services, which also includes then access to services and access to employment and skills. Data exchange is core to this program to be able to provide a centralized facilitation and database and governance for data, digital identity, as well as a secure and effective payment system for our society to make it more affordable for South Africans, especially our most vulnerable beneficiaries. So this is from our side. Thank you very much for giving me your time. Thank you.
Thank you, Mayopunit. That was an excellent presentation, sharing the level of interoperability and the speed with which South Africa implemented this. So I will now invite Louisa to engage for about 10 minutes in a dialogue with both the speakers. Over to you, Louisa.
Thank you very much. First of all, congratulations for your presentations. They were really good. And your design, your IT systems also look fine. I can say that because I saw so many of them in my country and other countries, a different type of IT system. So the design looks okay. For Ercan, for Turkey, I have a question. How easy was to get the data from all 29 institutions? This is a question because we had 18 institutions. It wasn't very easy. on our platform. So,
May I now or later?
Luisa, okay.
Yeah, I think I have to say that in the beginning of the 80s till the end of the 90s, Turkey has completed all the informatic infrastructural structure in Turkey for both the public and the private institution. We have already an informatic infrastructure. What we have done when we established the the ISA, Social Assistance Information System, and we have created some protocols among the different databases.
Institutions, yes,
So,
for databases exchange.
Yeah. Otherwise, it's not possible because every institution has different kinds of databases.
Exactly.
It is not possible to combine all of this, and we adapt and we improve the exchange mechanism for each institution. That's why we can combine the 29 institution and more than 100 databases in only
There's
one
enormous
integrated
data.
Yeah.
That's why I'm asking, because okay.
Sorry, Luisa. It took about 9 years to do this.
9 years?
At the beginning. 9 years at the beginning. Yeah.
Signing
Because
certain protocols for us with certain institutions for data exchange took a very long time too. Also, after signing, they were very reluctant to allow that data exchange. Even we don't want to give next month. They are some kind of afraid of, to give the data, but we need it because we have our projects. So this is all about, we need the data, and 18 institutions, Ministry of Education, Ministry of Health, I don't know, social inspection, and a lot of data, and we really need it because we couldn't develop the IT platform without them. So thank you for your answer. I have some questions for South Africa. I already prepared, so if I can, that's okay, yeah?
Go ahead.
So the first one is about the law. Have a new set of laws been initiated in the field of interoperability and cybersecurity support to support the implementation of the IT system? Because it's very important to have a true law. So this is my first question for South Africa. Maponi.
Yeah, may I come in now, Anita, or wait for the other
Please
question?
go ahead. Yeah, please go ahead.
Okay, thank you for your question. So the law or the governance framework as it relates to interoperability and all the cybersecurity that is linked to that has not been established. And currently there is still those disintegrated data sharing principles that has been observed. And that is why then this project has been selected to be managed at a presidency level. So this is the office of the presidency.
Because you didn't have the law.
To have the law, to have the governance framework that facilitates and governs this interoperability. So that is why it is placed at such a high level to be able to establish.
That's why I was asking if the law has been initiated, because it's very important.
Yes.
Okay, the second question, actually the third question, but links to the second. From the presented slides 23 and 24, it can be seen that the data exchange between institutions is done through bulk data transfers with almost no use of API development. which would allow real-time data access. What is the cause? Are the systems outdated, technologically incompatible, and not designed to support APIs? Or, linked to second question, is the IT human resource capacity with the institution targeted for data exchange sufficient to achieve the desired outcome? Is there an insufficient number of specialized professionals capable of developing APIs? So that's why I said the two questions are linked.
Yeah, no, that is excellent. So you are correct if you look at that analysis that we have done, and the results thereof was actually exactly to answer this question of why. Why are we not sharing the data then through APIs? Because from SASSA's side, as a design principle for this grant, we've already designed for API. So we used API first as a principle from development from SASSA side. But then when we reached out to external agencies to say, this is what we need to use, then that is the challenges that we are facing. No, we are not ready. We do not have API capabilities. We are not able to assist you with real-time data transfer. We have
And
our
they give
own
the files.
issues. We give you the files and we give you the files that we have. So that is the problem of fit for purpose. I will make an example with SARS, right? So for SARS, they collect data for their own use. So at a specific time in the SARS environment, they need now to assess to be able to give the outcome of tax assessment. So they've got a specific period where they are able to assess the information. From SASSA's side, we need the information to be fresh month to month, but they're saying, no, we've got data that is 12 months old that we can give you. That's all we can give you. So we need to take that, bring it home and say, how do we use this data in collaboration with other data to make sure that we can assess an outcome? So that is why governance and centralized management of data sharing has become a buzzword and has become very important as in South Africa currently, because of number one, we need to establish the capabilities and the ability of all the institutions to be able to share data within the technical frameworks in this data sharing, and able to now set the governance for facilitation of this data share.
So for you, because you are a technical person, and
Exactly.
you know what it's all about, is a little bit frustrating not to have API and to see the data in real time.
Yes, that has been our biggest challenge.
Yes, I can see that. That's why I was asking. The design looks very fine, but you still need to develop more modules as far as I can see. And the case management module is very important. The social services module. There are some red modules that still need to be developed as far as I can see. So you have a period of time you set for this developing of these modules, red modules?
So the red modules, as I've indicated in my presentation, some of them can still work within the current policy framework, right, of social assistance, individual based, but some of the capabilities needs to be triggered from a policy point of view. So policy needs to change to say we are driving social assistance from a social registry point of view, as well as from a household point of view, so that we refocus our attention from individual based assessment to looking at household. So there's some policy decisions, but neither to say that we are not looking at, there are some of those assessments that we have done from the needs enhancement in the yellow blocks and in the red blocks that we are looking at in preparation of that, because there is some paperwork that is being done from a policy perspective to prepare to that. So from a technical side, we're already saying as SASSA, let us prepare from a functionality and technical point through the work that we are doing with World Bank, then to make sure that we are ready for that policy framework when it gets changed, to be able to adapt then our systems.
So you are ready in advance when the policy is also set.
Exactly, because we know that there's white papers.
To be prepared, not to waste the amount of time after the policy. Yeah, Sure.
Yeah.
Very nice.
Maybe
I
just
like
to
that.
mention as well, yeah, to say within the presidency program, SASA actually has been selected as one of the pilot programs to be able to execute this work. So that is why it was important for us as well to say, where are we lacking so that we can improve, so that as we become the
Super.
target
Yeah.
organization for this presidency work, because of it was one of a kind, we are ready in terms of the
So you
technical
have a lot of
capability.
support from presidential administration as far
We
as
have a lot
I
of
say.
support from, exactly. Yes.
Mhm. This is very good. Thank you.
Yeah.
Yeah,
Thank you so
thanks,
much.
Lisa, and thanks, Mayapuni and Ercan. I think your questions were spot on, Louisa, trying to bring out from the all speakers the challenges they have faced, and the success that we see in Turkey is not 1 month or 1 year activity, but years of hard work with which this integration was achieved, and the challenges South Africa is facing with regard to integration. Now I invite Josefina to engage in a dialogue with the two speakers for the next 10 minutes.
Thank you, Anita. And I want to say also congratulations to Ercan y Moipone for the excellent presentations, and extend also the congratulations to your offices for the great work done in this area. So my question actually is for both of you. I know they are at different moments in the process of integration of data systems, and also facilitating the communication from the social assistance to the labor side. And having worked probably more with practitioners in public employment services like Ishkur and so on, I would like to ask you if you can give us a little bit more of details on that referral process that is happening from the social assistance to the employment services, and if there is one that goes in the other direction. And related to that, I understand there is a lot of information, 29 databases integrated in the social integrated system. So how much of that information is used by the employment services or by Ishkur, for example, when they designed and they receive these referrals? Employment services have programs that target the vulnerable, but they have other functions that are related to facilitating job-to-job transitions and job placement for a larger group of the population that may not necessarily be the most vulnerable. So is there any of that information that is useful for other segments that are clients also from employment services? Over for now.
Okay, thank you, Josefina, for your very good question. It's a chance to explain for me in details. Yeah, as I said at the beginning, when our social worker visit the household, that is a questionnaire, social inquiry form. In that questionnaire, uh, our social workers asked some question about the employment. For example, if you have a chance to work or to find a job, can you work in that job? And there are some questions. And at that time, the house of visit, we already identified the potential beneficiaries for the employment market, labor market. Then we directed to these potential beneficiaries to the employment agency. From the beginning, we have such a data, such a information about the beneficiary. It's a regular program, referral programs. We we run these referral in all over of the region of the Turkey. But when we look at the impact of these referral programs, as far as I gave some person for the employment and the registration in my presentation. We have registered about in 2 million people in the İşkur program. İşkur program, 2 million in almost 15 years. 15 years. This is the what we achieved in 15 years, and we have given some counseling or the trainings to about the 500,000 beneficiaries. We have trained that beneficiaries in the last 15 years. But the numbers are very small when we think the target. Just we have registered just 10% of our potential beneficiaries, and 13 or 14% of them have been employed. It means that 1 in 100 beneficiaries had a job. It is just 1% when we look at the whole system. It is not satisfied for us, I think. Yeah, that's all. Have you any other questions, Josefina?
I have.
Yes,
Okay.
a follow. I'm sorry, Lisa. Follow-up question. So just to be sure that I am understanding, the referral is given to the beneficiary from this when they come to the social assistance center and they see the information you collected, or is it sent to someone in İşkur that would contact the beneficiary to incentivize them to register? Because I was also noticing the very low numbers, so I was trying to understand where it could be the bottleneck, or where is the barrier in registering and helping those beneficiaries. Thank you.
Yeah, after the household visit, when we enter this household visit data into the system, it goes automatically to the İşkur, the employment agency. The İşkur colleagues see how many people in that region or in that provinces are the potential beneficiaries. They contact with them. They contact with them, and after they contact, they inform us. They inform our system as well. That there is such a system. We automatically send all the data for the potential beneficiaries for the employment market, labor market, and when they see in their system, the employment agency, they call these people to the center, the employment center, and they inform them about their programs and training programs or counseling programs and blah blah. And then all the system automatically runs. Most of the programs or activities automatically run, I think. Okay, Luisa.
One more question.
Yes.
I saw maybe I wasn't I didn't pay many attention to this, but you said in your presentation that after a beneficiary got the job, the social worker still assists and 6 months or 1 year, something like that, and
1 year.
he still get the payment.
Yes.
Why is that? I have some answers in my mind, but why?
Yeah.
Maybe if I may, because that was one of my questions too.
Yes.
Luca,
Okay.
is that just to complement Luisa's questions and let you have a more organized, comprehensive answer, Ercan. I can understand why. I'm currently working with the government of Brazil, and they have a similar rule that it was just amended to reduce that time from 24 months to 12 months. So I would be very much interested also in hearing from the experience of Turkey. How do you reach, what type of analysis you do in order to understand whether 12 months is the right duration of that period? And what kind of analysis you do these days in order to see if that's working well, whether some people are coming back to the program after the 12 months because they fall back into poverty, and a little bit more of an understanding of what is the monitoring information that we are getting from that design to see if it is 12 months the right period. Over.
Yeah. Thank you, Luisa Josefina. Let's suppose a man or a woman has a job. One of our beneficiaries has a job. Okay. He is still in our social assistance system because when we cut all the social assistance of that household, maybe he or she can lose
Drop the job.
Yeah, or maybe they don't want to work in that job. So that's why we need to create a sustainability of the both programs and the income security of the that family. That's why the 12 month is much more reasonable for that house. But if there is any changes, because we regularly check all the household in our system, we check all the houses once or twice in a year. Physically visit them, and also we check their administrative data in every month. That's why we need
you
to
have the API or anyway to
yes,
you have the
yes.
API so that
Yes, very developed API. That's why we need to fix them in at least 1 year into the system. If they still in employment market, if they created their income security, then we exit them from our social assistance system.
Thank you.
Yeah.
Çok teşekkürler.
Okay, Luisa. Thank you.
Thank you. I think Josefina, if you have a question, quick question for Mayopone, I can take that. Then I want to give a few minutes to the audience too.
Sure. No, I
And
think it would be
responses can
terrific
be-
to hear from Moipone also on this very same question, even if I know that they are at a different moment in their development process of the integrated information system and interoperability. It would be nice to hear how do they envision this communication between social assistance and employment going forward.
Yeah, thanks, Anita. So from South Africa side, we still have a disintegrated referral mechanism. It's not as comprehensive as Turkey with regards to that. So there is still one-to-one sharing of data with targeted organizations upon request, even with some. For an example, I will make example with the community works program. There will be specific intervals in a financial year where they would request data from SASSA so that it can enable their targeted approach to target the qualifying clients from their side. So that cuts across any of the agencies that request data from SASSA. So there is no comprehensive and consolidated data sharing and referral mechanism that is in place currently in South Africa. It's still on a one-to-one basis to drive specific projects and programs within a specific organization, as also shown in the picture that I have with all of those data sharing institutions that we target for employment as well as skills. There is a one-to-one sharing of data and reconciliation thereof, no comprehensive value chain then in terms of the referral. Thank you.
Thank you to both the discussants, Josefina and Luisa, for the questions and the speakers for the responses. On sort of a rapid fire kind of questions, I'll take few questions from the audience and request you to answer in short. In case there is a longish answer, please feel free to type it in the question and answer panel. So the first one to you, my opinion is from Irene. Are there any legal challenges or active court cases regarding data sharing between SASSA and other actors?
Yeah, thank you for that. So there is currently actually a case with regards to the data sharing with the banks for proxy means testing, whereby it is been sanctioned then by the oversight committees regarding the use of that data then to be able to determine means testing. So it is currently an active court case, but it relates as in the fairness or the legality of SASSA using that information from the banks to then do the means testing and legibility outcome. So we do face that, but it is at that level then where people question the legality and the fairness of the process more than the use of saying you don't use my data, because there is consent that is signed as part of onboarding, but it is more on the fact that it's not fair that you are using it. But SASSA is driven from policy side. So policy says use this data. So I guess this court case is actually causing the questioning the policy rather than the system of administration. Thank you.
Thank you. So this question is to you, Ercan. How regularly is the means test assessment carried out? And what is the rationale against a purely income tested system?
Sorry, I forgot my mic. Yeah, as I said in my presentation, when our applicants apply to the system, at the beginning, we use the means testing for every applicant. Then, especially for regular beneficiaries, for example, they have the regular salaries or regular assistance, let's say the disabled people or for the disabled people, we make the means testing for once or twice in a year for every household for the regular beneficiaries.
Thank you. So the next question is, are there any rules for job referrals? Do applicants need to accept any job or only jobs that fit their profile?
Yeah, we have in the İşkur, the employment agency, they have offered at most 3 times 3 jobs to our beneficiaries in a 1 year. If they accept one of them, that's okay. There is no problem. But if they don't do three of them, three offers, uh, we need to reevaluate their situation, socioeconomic situation, and eligibility situation. If they don't accept it, all of them, generally we exit these beneficiaries from our social assistance system. So we try to create a section sanction for the referral services.
Thanks, Ercan. And probably this is the last question to Mayapone before we bring to a close. Does your system allow you to collect family photos? Do you allow collection of fingerprints?
Thank you. So because our system is an individual-based system, so we do collect the biometrics of the clients in the form of facial, because this is a digital online facing solution. So we collect the facial biometrics of the clients that we currently target for high-risk transactions. So it's actually a video as part of our eKYC process, but we don't store the actual images. We then convert those images into a template that we can be able to verify against them as part of ongoing maintenance of the record. Thank you.
Thank you so much. I think it's time to close, though. I think we have interesting questions and interest from the audience to continue for some more time. But I would welcome both of you to respond to these questions in the chat, which we can then share with some of them whose questions we could not pick up. So now it's time to thank you all and bring this event to a close. We are really grateful to the speakers and to the discussants and to the audience for this engaging session. So just last 1 minute on what is next. We have a next Talking Interoperability event where we would be speaking about the middleware or the data exchange layer, which enables this interoperability and how different countries have deployed these data exchange platforms for exchanging data. Do register at the sp.org, socialprotection.org for June 24th, same time. Moving on, we invite you to contribute to this initiative, whether it is standards development, joining these webinars, or if you want to contribute your country session for a Talking Interoperability session, do reach out to us, and you will see on the next slide, you see our website link, and also you can reach out to us on LinkedIn, and also look at our standards on Gitbook and GitHub. Ours is a very open community. Anybody and everybody is welcome to join and contribute to the digital transformation of social protection systems globally.
Thank you
Thank
for
you all.
invitation.
Thank you so much.
Thank you for all audience and all people in this system. Thank you. Bye.
Thank
Bye.
you.
Bye-bye.